Hey everyone, how you doing? It's Silent Phil here, or Philip Escobedo, for those that don't know me by my YouTube handle name and gaming name, I guess. I know it's been a short while since I made an update. I'm sure many of you have been wondering what's been going on. I've just been so busy with information overload lately. I do have a whole script here that I'm going to be reading from, so I'm going to be looking at the screen, not so much at the camera. So I do apologize for that. It's just like a lot of stuff has happened. Okay, so back on Monday, January 23rd, I had my first follow-up appointment with my surgeon and the pathology department. So if you're kind of wondering what's going on, this is going to be kind of a catch-up healing and pathology report. That's what this update's all about, and it is going to be attached to my GoFundMe update as well. So everything I'm saying right now is going to also be in the GoFundMe update, but just typed out, worded, in case you get lost or confused or don't know what something I said was. I'm just pretty much, like I said, kind of reading from a script. It's a long script though, so this will be kind of a long update, and I apologize for that again. So if you're wondering what's going on, just look at the previous videos that I did before this to kind of have a little bit more of a catch up. I'm going to also kind of be repeating some things in this video as well, okay? So I was, sorry, give me 1 second. Okay, so I was informed that yes, my scars are healing quickly. This is the whole healing stuff, like, because, I did have staples, of course, the whole brain surgery thing going on. I did have staples in my head, and, sorry, yeah, people walking behind me. But they did take him out. They did leave one in, though. I think it's just because my hair was so matted because I was wearing this hat, and the hair was just like so matted on my head and was just covering everything up. So it's understandable. There's still like a staple left, like right in here that I need to get taken out. I still have my stitches in from when I had the lipoma removal, so I have that covered up though. So I need to get those taken out as well. My stitches taken out. But the doctors did say I was healing quickly, and they were impressed with how quickly I was healing. I'm hoping to get the stitches taken out this weekend. Sorry, I kind of lost myself in the script here. As the area is starting to turn more and more red, though I have been lifting and moving heavy objects, that's probably just my stubbornness flaring up, so to speak. So other than that, for the pathology report, okay, so for those of you wondering, it turns out it is a grade 4 glioblastoma, also called glioblastoma multiforme, or GBM for short, and is a fast-growing type of brain cancer. Brain cancer happens when normal cells in the brain change into abnormal cells and grow out of control. Brain cancers can be named after the type of cell they start from. GBM starts in the glial cells of the brain. Glial cells go between and around the brain's nerve cells. As GBM grows, it can spread into healthy parts of the brain. It can also cause brain swelling. Grade 4 is different from stage 4. 4 is still the most aggressive though. Grade just stands for the speed at which it grows, and stage means the size and extent to which it will grow. They say it is rare for someone my age, and I'm going to be 30 in May, to have this type of brain cancer, but thankfully there are the usual treatments, and that it should just stay in the brain, not going anywhere else in the body. So I suppose that's a positive. Remember, they could not take it all out, so I will have to go in for blood tests and MRI scans to make sure it doesn't try to grow back somewhere else in my brain. It can be nothing, then maybe 4 years later or something. It does have like this fuzzy edge to it, like no clear-cut wall, as I've mentioned in a previous update or video, that blends too much into healthy parts of the brain, meaning they will probably never really be able to take it out completely. So the typical symptoms include headaches. I have constantly, so I have to take pain medications to keep them at bay. Seizures, and that's how I found all this out. I went to bed one night just fine and woke up in the hospital the next day on December 28th with no recollection of what had happened. And according to Michael, said he woke up, my arms were outstretched, muscles all tense, having full body convulsions, eyes rolled back into my head, foaming at the mouth. He called 911, said it took like 5 guys to hold me down and sedate me. I guess they were taking me down the stairs, and I had another one, and then a third one in the ambulance on the way to the hospital, where they had to sedate me each time, I guess. Again, I had no clue that any of this happened. I just woke up in the hospital. Also, just memory or thinking problems. I used to be a quick thinker, and now it takes me a second or two to process what I'm doing. And it's also very easy for me to get distracted. There was the day where I had to ask like 20 times what day it was because I just forgot. I've also had to start a to-do list and shopping list just so I can remember certain things. I know others do that as well, but I've always been good at just remembering things in general. Keep in mind, I graduated as valedictorian in my class, so now my focus and retention is just terrible. I do get, like I said, distracted easily in terms of, I start a project, then see something else that needs to be done, or someone starts talking to me and I completely forget the current project I was working on, or where I was going, or what I was doing. That's why I need my to-do lists. Let's see. There's also muscle weakness, which I've been pretty strong. Vision changes, which it's about the same. Language problems, such as trouble finding the right words for something. It was really bad right after the seizure date, again December 27th, 28th. But I've been mentally training myself to either think and or talk more slowly, or just write down a whole script like this one right here. There's also personality changes, so no matter what, I'm just trying to keep on smiling, because I do seem to get agitated a lot more often than I used to, and tend to step back more at people, or I just speak my mind a bit more, which can or cannot hurt someone. I'm trying to be mindful about that. Waka waka. Now, as for the treatments, in a couple of weeks, I will be starting both radiation and chemotherapy. Radiation will last for about 6 weeks via visiting the hospital 5 days a week to get zapped, and chemo will last for 6 months via capsule from home, which is nice, I guess, in a dark, twisted kind of way, I guess. Radiation side effects can include, most likely, fatigue, which may occur at any time during the treatment, and often becomes more severe in the weeks immediately after I am finished with my treatment. So I'll need to take short naps throughout the day to help manage. As it says, is the main reason why people want to take a leave of absence from work, which for me might be the theater. Just depends on how that ends up being, because for the game job, I do work from home while undergoing radiation. So though they can prescribe medication to make me more alert, which is most likely the path I'll try and take, just to keep myself going, keep making that money, right? That dough. More headaches, just keeping that extra strength Tylenol by my bed, and my prescription pain meds. Skin irritation or rashes. If they start to develop, I have to get evaluated at the doctor's office. Can sometimes be treated with prescription or over-the-counter meds. Hair loss at radiation site only, which would be the right frontal lobe area, can be temporary or permanent. Short-term hearing loss due to ear or ear canal reaction. Possible increase in brain tumor symptoms such as headaches, seizures, or weakness during treatment. Then the less likely would be nausea, vomiting, mental slowing, permanent hearing loss, cataracts, behavioral change, temporary worsening of existing neurological deficits such as decreased vision, drowsiness, change in level of some hormones related to changes in the pituitary gland, or dry mouth, because it can make me dehydrated, which can be relieved by mouthwash such as biotin, chewing gum, or sucking on candy. Yay, candy! Boo, calories. Altered taste most likely will return when radiation treatment is over, and have to use baby shampoo to wash my hair and avoid, of course, hairsprays and other chemical treatments. So goodbye color. Sadness. And of course, dry eyes, so eye drops, I suppose. And then there's also the rare but serious side effects of radiation, which is severe local damage to normal brain tissue, a condition called necrosis, which is tissue deterioration. Radiation necrosis can mimic current brain tumor and may require surgery for diagnosis and treatment. Injury to the eyes with possibility of blindness, development of other tumors, either benign or malignant. As for the chemo, I'll be taking an oral capsule, chemotherapy agent called Temodar, on or about the same time I begin radiation therapy. It says I should begin taking Temodar the night before I start my radiation therapy treatments. However, if I begin a few days later or miss a dose or two, it's okay. There is room for flexibility, but again, I'm just always on top of things if I can manage, so I don't think I'll be missing a pill will be an issue for me. Research has demonstrated that there are positive interactions between Temodar and radiation therapy, with a large clinical trial conducted in Canada and Europe several years ago that found patients receiving 6 weeks of Temodar and radiation did better than patients receiving radiation alone. This has become standard care for patients with glioblastoma multiforme and anaplastic astrocytum, whatever that is. Temodar is an alkylating agent, and being a capsule should be taken, of course, orally. on an empty stomach, meaning at least 2 hours after a meal, and the dose is based on my body weight and height. So during the time I'm undergoing radiation therapy, Temodar will be dosed at 75 milligrams per meter squared and must be taken 7 days a week, even though radiation treatments are Monday through Friday. The dose will increase later in my treatment plan. Temodar, of course, also has side effects, which is more fatigue, so I'm going to be getting some good naps in, I guess. And it's also recommended that I take Temodar at bedtime, so it won't mess up my sleeping schedule too much. Nausea, recommended I take anti-nausea meds such as Zofran or Kytril, K-Y-T-R-I-L, about 30 minutes before taking Temodar, so because it's easier to prevent nausea than to treat it once it starts. Constipation, recommended take anti-constipation meds like 2 to 3 times a day. Abnormalities in the blood that can cause like low platelet counts or low white blood cell counts. So I have to get blood drawn every week. If something is found, they'll let me know to prevent further complications. And again, more headaches, and I guess same type of treatments as before, Tylenol or my anti-pain medication prescriptions. As for work, I can still, like I said, work from home from the game job. It's all set up here on my computer, so that's going to be an awesome thing that I'll be able to do, like I said, making that money. As for the theater, it just depends on how I feel. I hope I don't have to take a leave of absence. I'm going to see, what medications I can take in order to keep my energy going and flowing, and see what we could do with that. Just taking it day by day. I'm not going to try to jump the gun or think of the worst things. Just like I said, keeping that smile on and just keep going strong, keep staying positive, keep positive thoughts going on. Because right now I am trying to keep myself active, keeping my stamina up and my energy going. That's what I've been doing for the past, since I've been home from the hospitals, just keeping myself going with projects and stuff. Maybe it's just a way I cope to help keep my mind off things. I don't know, but that's what I do. But I do want to take this time to thank my game job Tapinator, because they have given me so much love and support throughout this entire ordeal. I've been talking with them every day, and they've helped out a lot with donations and stuff like that. So, as a thank you, I ask you all to please go and check out our games on the Google Play and App Stores. They're usually free, and I would greatly appreciate it. It's like the Rocky game that I did the Let's Try on previously. I'll put like a little video link or something somewhere. I am keeping myself active right now, like I said, to heal more before the treatment start. But I also did sign up for a clinical trial research study to help test the effectiveness or how well the drug works, safety and tolerability of an investigative drug research. They had to take tissue sample from my tumor to see if I even qualify or if the cells are methylated or unmethylated. So I'm just waiting on that to see how that is. After my results are in and I meet the eligibility criteria, I will be randomized, assigned by chance, to receive either nivolumab, Nivolumab, also known as BMS-936558, along with radiation therapy. I'm just going to call it Nivo, is an antibody or a type of human protein that is being tested to see if it will allow the body's immune system to work against the tumor cells. So it is administered at a dose of 240 milligrams every 2 weeks for the first 8 doses by IV infusion, meaning the drug is a solution given through a vein and takes about 30 minutes. After the first 8 and beginning on dose 9, it will be administered at a dose of 480 milligrams every 4 weeks and may continue as long as I'm having benefits from it. Or there's another one I could be grouped into, which is temozolomide, also with radiation therapy. Sorry, give me a second. Alarm went off for medications. Temozolomide comes as a capsule and taken every day for approximately 6 weeks during radiotherapy, is what they call it, radiation therapy, radiotherapy. And I'm hoping I get put into this group because, then I get to have a 28-day break, making 28-day cycles. So like 5 days of treatment plus 28 days with no medicine. This dosing schedule will be continued for up to 6 cycles total and can be adjusted as needed throughout. So again, hoping I have that or get put into that group, so we'll see. Sorry, I just lost my place. Give me 1 second. Okay, so either can be started with, like I said, radiotherapy, again, Monday through Friday for the first 6 to 7 weeks of dosing. Reason for the trial is that there's still no cure for this cancer, even in 2017. So I want to help out in any way possible. Of course, being a clinical trial research study, there can be even more side effects overall. Being a study, random people can have differing side effects. Some may go away soon, some may last a long time, some may never go away, some may interfere with my ability to have children, which is fine. Some may be serious and even result in death. Joy, but so far no cases that I know of. It's just the worst possibility, which again, I don't want to think of the worst possibility right now, because if you let that consume you, then you'll just live a horrible life, I guess. So I'm just it is a possibility, but I'm just trying to keep positive about everything. So I just have to let the doctors know or the research team know if I feel anything different. They may be able to treat some side effects, even reducing the study drugs to reduce the effects. So Nivo has its own side effects, which there's quite a bit. I'm just going to read from the paper here. Yeah. Okay, so the very common is fatigue and rash. The general common side effects are abdominal pain, alkaline phosphate increased, ALT increased, amylase increased, AST increased, chills, constipation, cough, creatinine increased, decreased appetite, diarrhea, dry mouth, dry skin, fever, headache, lipase, LIPASE increased, inflammation of the colon, inflammation of the mouth, infusion-related reaction, itching, joint pain or stiffness, loss of color, pigments from area of the skin, lung inflammation, musculoskeletal pain, nausea, shortness of breath, swelling including face, arms, and legs, thyroid gland function decreased, thyroid gland function increased, thyroid stimulating hormone increased, tingling, burning, numbness, or weakness, possibly in arms, legs, hands, and feet, vomiting. And then uncommon side effects are adrenal gland function decreased, allergic reaction, bilirubin, which is liver function blood test increased, bronchitis, cranial nerve disorder, diabetes, dizziness, dry eye, hair loss, heart rate increased, heart rhythm abnormal, high blood pressure, hives, increased blood sugar, inflammation of the eye, inflammation of the heart, inflammation of the kidney, inflammation of the pancreas, inflammation of the pituitary gland, inflammation of the stomach, inflammation of the thyroid gland, liver inflammation, low blood pressure, pituitary gland function decreased, psoriasis, redness, renal failure, respiratory failure, sodium levels in blood low, upper respiratory tract infection, vertigo, vision blurred, and then the rare side effects, again, rare, meaning hardly, anaphylactic reaction, which is severe allergic reaction, damage to the protective covering of the nerves in the brain and spinal cord, diabetes complications resulting in the excess blood acids and diabetic coma, erythema multiforme, which is skin inflammatory reaction, Guillain-Barré syndrome, an autoimmune disorder associated with progressive muscle weakness or paralysis, inflammation of blood vessels, inflammation of brain, potentially life-threatening or fatal, lung infiltrates associated with infection of or inflammation, muscle inflammation, myasthenic syndrome, which is a neurological syndrome characterized by muscle weakness, including myasthenia gravis, a nerve disease that may cause weakness of eye, face, breathing, and swallowing muscles. Why do they name it like these? Why do they give them these names, huh? Polymyalgia rheumatica, an inflammatory disorder causing muscle pain and stiffness. Rhabdomyolysis, muscle fiber released into the bloodstream, which could damage my kidneys. Rosacea, sarcoidosis, a disease involving abnormal collection of inflammatory cells in organs such as lungs, skin, and lymph nodes. Stevens-Johnson syndrome. I wonder what happened to that guy. Inflammatory disorder of skin and mucous membranes, resulting in blistering and shedding of skin. Toxic epidermal necrolysis, a potentially fatal disease characterized by blistering and peeling of the top layer of skin resembling a severe burn. And then histiocytic necrotizing lymphadenitis, or Kikuchi lymphadenitis, a disorder of the lymph nodes which causes lymph node to become enlarged, inflamed, and painful, commonly affecting lymph nodes of the neck and possibly associated with fever or muscle and joint pains. Okay, I mean, that was like I said, that's a big list, but it's like most likely, and then regular, and then uncommon, and then the most rare. So, and then of course, let's see. Sorry, I'm just going back to this where I was at. Again, I do want to do this because if I could potentially help people further on, I would like to be a part of that. So also the temozolomide also has its own side effects. There's a page 14. There you go. So the very common are loss of appetite, headaches. We're gonna be having lots of headaches. Constipation, nausea, vomiting, rash, hair loss, and tiredness. And then just the normal common can affect up to 1 in 10 people. The very common is more than 1 in 10 people, and common is 1 in 10 people. Oral infections, wound infections, reduced number of blood cells, increased sugar in the blood, loss of weight, change in mental status or alertness, anxiety, depression, sleepiness, difficulty speaking, impaired balance, dizziness, confusion, forgetfulness, difficulty concentrating, inability to fall asleep or stay asleep. Yay! Fun stuff, right? Tingling sensation, bruising, shaking, abnormal or blurry vision, double vision, hearing impairment, shortness of breath, cough, blood clot in the legs, fluid retention, swollen legs, diarrhea, stomach or abdominal pain, heartburn, upset stomach, Pepto-Bismol, cha-cha-cha, difficulty swallowing, dry mouth, skin irritation or redness, dry skin, itching, muscle weakness, muscle aches and pains, painful joints, frequent urination, difficulty with holding your urine. Okay. No, I'm not going to be wearing diapers. Allergic reaction, fever, radiation injury, face swelling, pain, abnormal taste, abnormal liver function tests. And then the uncommon can affect up to 1 in 100 people is flu-like symptoms, red spots under the skin, low potassium level in the blood, weight gain, mood swings, hallucination and memory impairment, partial paralysis, impaired coordination, impaired sensations, partial loss of vision, dry or painful eyes, deafness, infection of the middle ear, ringing in the ears, earaches, palpitations when you can feel your heartbeat, blood clot in the lungs, high blood pressure, pneumonia, inflammation of your sinuses, bronchitis, a cold or the flu, swollen stomach, difficulty controlling your bowel movements, hemorrhoids, peeling skin, increased skin sensitivity to sunlight, change in skin color, increased sweating, muscle damage, back pain, difficulty in urinating, vaginal bleeding, which, yeah, that's not me, sexual impotence, absent or heavy menstrual periods, vaginal irritation, breast pain, hot flushes, shivering, discoloration of your tongue, change in your sense of smell, thirst, tooth disorder. Okay. And then I kind of already gave the side effects of radiation therapy, but again, tiredness, lack of energy, redness or soreness of scalp, hair loss, temporary or permanent, short-term hearing loss due to ear or ear canal reaction. This is the likely. And then possible increase in brain tumor symptoms such as headaches, seizures, weakness during treatment. And then the less likely, again, nausea, vomiting, mental swallowing, permanent hearing loss, cataracts, behavioral change, temporary worsening of existing neurological deficits such as decreased vision, drowsiness, change in the level of some hormones related to changes in the pituitary gland, dry mouth or altered taste, rare, and then like I said, the rare but serious is severe local damage to the normal brain tissue, a condition called necrosis, can mimic brain tumor and may require surgery for diagnosis and treatment, injury to the eyes with the possibility of blindness, those video games, development of other tumors, either benign or malignant, and then there's like tons of other things. Like this is a 30-page book. Like I'm not going to go through the entire thing, but yeah, that's a huge thing to go through. But but I do hope to be put into the temozolomide group, because it just seems easier to manage, I guess, and also with the the side effects seems a lot less strenuous. So fingers crossed. Okay, so I guess that's it for now. I know that's a lot to take in. Sorry, I'm sure this has been going on forever. I apologize. So remember, you can just rewatch this video or read the update, because it is more or less what I just told you all, but just in word form on my GoFundMe campaign, which will be in the link in the description below. So if you can help out, if you know anyone else that can help out, I would greatly appreciate it. Okay, I love you all so much. Peace out, and well, I will see you all later. Okay, and just remember to keep smiling, because I always am. Okay, peace.